So once everybody's on board, okay, we're doing a tooth on this molar here, then we're good to go. So once everything is correct, we're going to put some numbing jelly on the side of the gum. It's a topical anesthetic. All that does is actually decrease the amount of discomfort before the actual injectable anesthetic. It doesn't numb the tooth. It's not strong enough. Once the numbing jelly's been there, we give the anesthetic, a local injection. So the second part, once the patient's nice and numb, we have to isolate the tooth somehow. By isolating, it means we want the cheek and the tongue away from the tooth. And so we can actually work on it without hurting the patient or by accident. Actually, you can see on the zoomed in photo, it isolates the tooth. So there's no gum tissue around, no saliva around, no cheeks around. The mouth is a wet place. Not great. It's a wet place. And so it keeps everything nice and clean. And the blue color or green color or black color, doesn't matter what color, it gives you a bit of a contrast. So you really can see what you're doing. Okay, and it serves three functions. It protects, isolates the tooth from all the moisture, retracts the cheek and the tongue, and prevents the material, anything sharp or bad tasting, going down the patient's throat. The next step is we got to get to the cavity somehow. So we got to access the decay. And this is an x-ray. This is not this patient, but as you can see, the decay a lot of times, those black things, they're in between the tooth. But the top part of the tooth seems to be fine. But how the heck are we going to get in between the tooth? Unfortunately, we got to drill a very conservative hole through the top to get to the cavity. So we try to make that access as small as possible. We got to take out some of the old filling material. As you can see, as we drill down the filling material, all of a sudden you see black. So underneath the white filling and you see black, you got to go and scrape at it and see if it's soft. And in this case, it was. So the filling's been leaking underneath. So after we got to the cavity, we got to remove the entirety of the cavity. We don't really want to leave too much behind or any behind if we can help it. Sometimes it's difficult to tell, but how are we going to tell is mainly by tactical feedback. Sometimes we will use a little bit of a dye that can dye the tooth, but in this case, mostly tactical feedback. A part of the tooth that has decay is going to be softer than the healthy part of the tooth. And just a general rule of thumb, the enamel, if it's not so good enamel, if it's softened enamel, it's got this frosty and chalky white look, and it's not very smooth. So that's how we tell if there's cavity left over on the enamel.